So a mammogram is a low-dose x-ray of both breasts, and the importance of mammograms is that they save lives. No test is perfect, but there's a lot of data showing that when done yearly in women over the age of 40, mammograms can lower the death rate or improve the survival from breast cancer by over 40%. It is the gold standard in improving survival from death from breast cancer because of its power to detect breast cancer in its earliest stages, stage 0, when it has not formed a lump that can be felt or seen on a clinical exam. So breast density refers to the ratio of the amount of fibroglandular tissue versus fatty tissue in the breast. All women have fatty tissue in our breasts, and we also have the glandular tissue, which is what comes in puberty, and fibrous tissue kind of holds it all together like scaffolding. On a mammogram, the fatty tissue is gray, or you can see through it. It's translucent. I reference it to like Scotch tape. You can see through Scotch tape. The fibroglandular tissue termed together is white on a mammogram. And so it's kind of like masking tape. It's harder to see through. It's more opaque. And so the problem therein is that women that have denser breast tissue, it's harder to find small cancer, small lumps within that dense breast tissue because they're the same shade of white on an x-ray. So it's like that polar bear in a snowstorm analogy. And women that have fattier breast tissue, it's easier to pick out a small lump because of the difference in the shades of gray and white. And so the sensitivity of how well a mammogram can pick up an early breast cancer, a small lump, is much higher in fatty breast tissue than it is in dense breast tissue. The other issue is that this is all genetic and hormonal, so there's nothing that a woman can do or not do to change their breast density, and so it's just how breast tissue is made. The FDA rules now require all states to directly inform patients in plain language, in writing, whether or not they have dense breast tissue. So previously, a woman was only notified if they had dense breast tissue, and only according to state laws. So there were about 30-some states that required mammography practices to inform patients if they had dense breast tissue in writing in plain language, but the wording is inconsistent, and it wasn't across the country, so it was kind of inconsistent around the country. So this new FDA rule standardizes the process so that wherever you go, anywhere in the country, you will have this information, and it also created standardized verbiage, so every facility has to use the same exact wording to minimize any confusion or misunderstanding, and that information about breast density has always been available to the referring clinicians, to the referring doctors in kind of the official radiology report that goes in the computer in the patient's chart, but now this information will be provided directly to patients and in plain language to kind of allow them to make decisions that further inform screening and risk reduction and prevention. I should mention one other thing in addition to the issue with detecting small cancers with dense breast tissue. Dense breast tissue in and of itself can also increase a woman's risk for getting breast cancer. And so if they have other risk factors like family history, then that, in addition to the breast density, can elevate their lifetime risk to the point where they do qualify. They do meet the criteria for more aggressive screening and risk reduction and preventative measures.